class because we are recording the class, so we don't want anybody to disturb us. Okay. Okay, so good afternoon once again. Welcome back to another semester. You are all welcome back to another semester. And then this semester, we started with an introduction. We started with an introduction, and then we were going to look at what we are going to do so far. And I know most of you have done Purperium. Everybody, it's not even most, all of us have done Purperium back in our diploma level. We know something about normal Purperium and abnormal Purperium. And now we are back again to Purperium. We're in the BAC level. So somebody will ask, oh, is it not the normal Purperium that we know that we have been doing in our diploma level? Is it not that same Purperium that we are going to do in the degree level? So somebody will ask, is it not the same Purperium that we are going to do in GCUC BSc level? Then if it's the same Purperium, then there is no need for me to be coming for lectures because I know Purperium is not difficult. And then we have been doing Purperium, so there is no need for me to. There's nothing there for me. The answer to that question is no. We are going to do something more advanced in this subject. The Purperium that you know in your diploma level, you are going to have better understanding of what goes into the Purperium. The things that you used to do, or at first you used to understand that when the mother delivers and the mother has high body temperature, it's paresthesia. So you just do any management anyhow. You just take your history, nothing guide you, and then you are just managing the clients. Here, we are going to learn so many things that we did not know, or things that we know, but we were not doing it right. And that is what we are going to do. Therefore, if you absent yourself from lectures, it's going to affect you. Seriously, it is going to affect you. And you will be lost in the system. Therefore, everybody is encouraged to join the class on time. The class starts at 3 p.m. and will close at 5. All other things being equal, by 5, we will be done with the class. Therefore, you need to join the class, follow whatever we will be doing. If you don't understand anything, you just type in the chat box, and then I'll read from there. At the end of every lesson, you'll be asked to ask questions. And then if you have any question, you can ask. We are going to contribute, share experiences, and we are going to learn a lot. So that by the end of this course, things that we did not understand back in our diploma level, now we will say that, oh, I see. That syndrome will have to come in. So we are going to do something more advanced, and it will become a little bit difficult because this is our first time of doing certain things like that. So in the beginning, you will find out that it is a little bit difficult, but with time, if you follow the class, you'll be fine. And my objective is that whatever we are going to learn here, you will apply them in the world. At the same time, if you are a colleague tutor, and you teach PUERPERIUM, or you have somebody teaching PUERPERIUM, the person too can apply it in the classroom. Because I said the classroom is the most important thing. If we give students false information, they will come out and practice or give poor services to the client. Therefore, it is my objective that by the end of this course, you should be able to get the concepts, understand, and then apply it in the field, so that you'll be able to bring change. The things that you used to do at first in your consulting room at the postnatal clinic, you will need to change, so that now you will be doing something new and everybody will know that there is a change in you. And we said knowledge is supposed to be shared. So whatever you get here, you share it with your colleagues. And how do you do that? In a peaceful manner, but not like I know more than you, or not that I am above you, not that I am doing a degree. You are not doing a degree. No, it shouldn't be so. However, it should be that we all come together, share ideas, and then we'll be able to manage our clients. And that is one of the reasons why we are here. So we are here to learn, and we are here to go and make a change. And the change that we are going to make should be a positive change. It shouldn't be a negative change. It should be a positive one, so that our clients will be very happy. And then they will pass through the period of 6 weeks without any complication to the baby and without any complication to the mother. That is why we are here today. Apart from that, certificates, we will get our certificate, we will pass, and then we get our certificate. But before you be able to pass, you should be able to understand what we are doing, and you should be able to apply them. And that is why we are here. The certificate will come later, but our ability to make a change in our practice as midwife save life is the most important thing. And that is why today we are all here. So we will look at what we are going to do. So this week will be an introduction week. And then next week, we are going to start giddy. And then we will go. So we are going to look at the respectful maternity care. I know most of you have heard about the theory of respectful maternity care. However, the importance of it and what are the strategies? How do you apply the respectful maternity care? Now, before I continue, the subject is 2 in 1. Normal PUERPERIUM. So we will do normal PUERPERIUM. And when we are done with the normal, then we will move to the abnormal. You know, you are also doing normal pregnancy. Then the next semester, you do abnormal pregnancy. But here, PUERPERIUM, we have combined the two. So we will start with the normal PUERPERIUM. And when we are done with the normal PUERPERIUM, then we will move on to the abnormal PUERPERIUM. So we are going to do 2 subjects. That's a start with the normal. So that means we have a lot of things to talk about. And we have some few weeks to do so. So we're moving a little bit faster. Moving a little bit faster doesn't mean we are going to rush, whereby you will not get any understanding. We will move fast, but we will also ensure that you understand what we are doing. So we will look at the respectful maternity care to we, the midwives. And why the respectful maternity care? The importance of the respectful maternity care and the strategies. The strategy. that we are going to use. So you have heard about the respectful maternity care, but how do we apply them in the world? How do we apply it in our classroom as tutors? How do we apply it as health educators or health promoters? And so we'll go into details on it, and then we'll do a lot of discussions. And then we will talk about the clinical decision making. And then the clinical decision making, how do we apply the clinical decision making as midwives? It is very, very important for us to know how we are going to apply it as midwives. Because if we are not able to apply it, it's dangerous. When you go to the ward, the moment you receive a client, then we start like that. Mommy, then how? Where do you have the pain? And when did they started? Then we will start. We need to follow systematic steps in the management of our clients. Then we look at the midwifery process. Now, the midwifery process, we are now using the NANDA diagnosis. So I think most of us are not used to the NANDA. So we will have to go and download the NANDA. I'll put it on the page. Then you go through it, and then you'll be given an assignment on that. So the nursing midwifery process, or the nursing or midwifery process, we are going to look at it. And we are going to use it. Now, most midwives want to travel outside. And I think most of you are even ready to go. Therefore, when you get there, you cannot just manage a client anyhow. You need to use the midwifery process or the nursing process. So we should start using it in Ghana so that we will be used to it. I know the world. I think Ghana Health Service have developed something like that. And some of us have started using it. But we using the NANDA is very, very important, that we should know how we will use them. The midwifery process, we should know the objective information or the objective data, and then the subjective data. And then how do we develop our nursing orders? And then how do we develop our nursing interventions? And we all know the interventions are the same as the orders. When you carry the orders out, then it becomes an intervention. And then the assessments. Are we still using our assessment tools as midwives? So we will be given an assignment on that. The assessment tools. I know some of the facility, they are still using it. You go there and the assessments, BMI assessment tools is there. But how many of us know how to use them? The pain assessment tools. If the woman is in labor, do we use the pain assessment tools? And which one are we expected to use? The mother with preeclampsia, or the mother who has an eclampsia and is in the state of coma, do we use which tools are we supposed to use to do the assessment? So when we get there, we will have an assignment on the assessment tools in regard to the nursing process. So we will be given an assignment there, and we will be asked to submit it to my mail. Then, please, if you can't hear me, you can type in the chat box. Sister, we can't hear you. If you can hear me too, you can type, sister, we can hear you. Then we'll proceed. Then we will talk about the physiological changes of puerperium, where we talk about the changes in the reproductive organs. We all know the changes in the reproductive organs, but the problem here is that, are we able to detect the normal from the abnormal? This is why we have an issue. Are we able to detect that this uterus is supposed to be palpated midway between the umbilicus and the upper border of the symphysis pubis? Are we able, if it's about the changes, we have done it in the diploma level, we know, but are we able to detect the normal from the abnormals? This is what the problem is now. And that is where our concentration will be. our concentration will be the differentiating the abnormals from the normals. Okay, that is what we are going to do so far. Okay. Then we look at the, please, if we are receiving the next slide, let me know. I'm on the management of puerperium. So here, we'll look at the management of puerperium, that is postpartum blues. We'll talk about postpartum depression and postpartum psychosis. So we will look at how these three conditions are related. The postpartum blues is for the puerperium, that is the normal. But when we get to the abnormal, that is where we talk about the depression and then the psychosis. And how do we, as midwife, assess the puerperal mother to identify those disorders or abnormalities and manage on time? Because sometimes there is a need for us to refer to the psychiatry units. And how do we collaborate with the nurses there to ensure that the mother receive or the baby receive the necessary care that they need? Remember, even if you refer a mother with postpartum psychosis to the psychiatry unit, you as a midwife, you will still have a responsibility about the baby to follow up and see the way forward. Even if you can't go there, you can even call and look at the way forward. As far as the mother is in the period of 6 weeks, the mother is still within the care of the midwife. So we look at how do we manage a puerperal mother and then the baby. I always say that after delivery, that is not all. Pregnancy is another problem. Delivery is another problem. And the period of 6 weeks is another big problem. Because that is where we normally don't take it serious. Let me put it that way. Okay? Oh, the woman has delivered, he will be fine. But there are so many things that will be going on wrong with the mother and the baby. And that is where we normally lose the baby and the mother. Because, after delivery, we don't pay attention to certain key or vital signs that we as midwives, we need to take good care of it. So we just overlook things and we think and people die from poor monitoring. Okay, after delivery, or midwife don't see the need to go and check the post-delivery vital signs. He does give it to anybody to check, and by the time you realize the client is gone, and we are losing most people from poor monitoring. So we should still keep an eye on them. And the minor disorders are now becoming complicated. The minor disorders we are overlooking the minor disorders, and it is becoming very complicated to the mother. So we look at it, and how many of us are even able to detect the normal from the abnormals. We look at the management of the newborn. That is where we talk about resuscitating the newborn. Now, resuscitation has become one of the issues. But before then, we look at the characteristics of the normal baby. And then we look at the essential care of the newborn. That is where we will be able to detect babies who need help, babies who need advanced care, babies that we need to refer. Those babies, they need advanced care, and those babies, we need to refer them so that they will be able to receive the necessary care. Resuscitating of the newborn baby. The golden minutes. The golden minute is very, very important. I always say that if the baby passed through the golden minutes, and then you try and resuscitate, and the baby survive, the brain cells are dead. Though the baby will be alive, but it's going, and in the future, baby may have a lot of issues. That sometimes even the parents with the baby is dead. So we are not supposed to joke with that 1 minute, which is the golden minute, to save the baby life. And how many of us even have the skills to do the resuscitation? Then you talk about clean birth and cord care. Clean birth has become an issue. Clean birth has become a big issue now. Because when you go into our labor Right now, as I'm saying, what I'm saying, you just look into your labor ward. You enter into a labor ward, and when you look at the setup of the labor ward, you don't even feel like lying on the couch to deliver. You find that the couch, the blood, the wall, it has a lot of blood splashes on the walls. And sometimes if we lift the mattress under the delivery couch, you see blood, accumulated blood there. Even the stool that the chair that the client will step on, bloody. Clean bed. Clean bed has become a big issue. Very, very big issue. You go, our aprons are bloody. The boots is bloody. Patient's washroom, the water closet is bloody. Everywhere is bloody. So that is not supposed to be so. Our maternity wing should be clean. And I always said, I remember when I was a student, we will go for clinicals, and then we will be asked to scrub the walls. And when we are done, we are asked to serve bedpan. Go to the street room, wash the bedpan. And nowadays you go and the labor ward, everywhere is bloody. Blood, blood, blood. And then the scent that will even welcome you, will even put you off. Because midwives, we are now waiting for the hospital orderly to come to mop the floor. Meanwhile, we can just put on our utility gloves and then we will mop the floor and everything will be fine. So clean birth has become an issue. So look at your labor ward now and then tell me what is happening there. Sometimes we don't even decontaminate our instruments. We don't autoclave them and we are using it for the next patient. We put it in our patients. We are spreading the STIs, HIV, hepatitis B, syphilis. You go from, just a clean birth has become an issue. I don't want to talk about. But I remember when I went to be an examiner somewhere in the facility, everywhere was bloody. And I was she removed the cannula. And then just put it in the this thing. How do you call? How do I even say it? The mattress. He just put it at the mattress. And she was going to do cesarean section mother dressing. And he was having the cotton, holding the cotton in one hand. And clean birth. And I couldn't stand but to complain. Those who know me, they know me, than me, I won't keep quiet. So I have to complain. I complain everything they were doing. So I have to go and buy sandals. And because the shoe that I will send, I can't bring it back to my village. And in the next minutes, the maternity in charge was looking for me. They said there's one examiner, everything the mouth will say, everything the mouth will say. I said, please, he says, you came to the blah, 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 blah. And I said, my mother or my sister, we are talking about clean birth here. What is happening here? It's not nice. Patient washroom. We are not observing. When we get there, we close our nose and pass. Then we run and pass. But we are sitting there and we think everything is fine. Things are not done well. Clean birth has become an issue. That is why now you as a midwife, when you want to deliver, you now want to go to private hospital. When you look at outside, look at how they have done their awards. Even if you don't have the items, you see, this is one thing about me. I'm doing course content, but I end up teaching. Let me continue. So cord care too has become an issue. The cord care, who are now saying chlorhexidine, Others are saying clohexidine. Others are saying methylated spirits, and so on. So we will look at it. Then we look at exclusive breastfeeding, early and then breastfeeding. Are we doing the early breastfeeding? Ask yourself this question. After conducting delivery, within the first 30 minutes, do you put and make sure the baby is suckling well? Are we doing it? So we will look at the gaps. And then when we look at the gaps, sometimes when we get the gaps, you can even use it to do your research. You can use it to do your research. Then we look at eye care. How do we care for the baby's eye? Okay, then we look at immunization. And then when we get to immunization and coaching, immunization, is it the responsibility of the midwife or is the responsibility of the CHN? Then we look at which one is for the CHN and then which one is for the midwife. And you can see that we have a lot of things to talk about. That is why I said we will need to move with speed. Then we will look at identification and management of the sick newborn. The sick newborn. Who is the sick newborn? How do we identify it? And how do we manage the sick newborn? And what are some of the conditions that classify the baby as a sick newborn? What is the time? Let me look at the time. Then we will now jump into management of abnormal puerperium. We are there. Abnormal. We are here. We are done with the abnormal. And then we will try and finish. And quickly we are jumping onto the abnormal. The abnormal is here. We expect that after delivery, everything will be fine. However, there can be abnormalities where the mother would deviate from the normal curve to go to the abnormal curve. And we as midwives, we have a risk. If I'm saying midwife, include both males and females. Okay. Including now, people were saying mid husband, they are all midwives. So we will now have to help the mother to come back to follow the normal curve. And so our ability as midwife to identify the abnormals. And we are going to look at the purpura parresia, purpura sepsis. And this one that we are going to look at, when we get here, we are going to use the theory, respectful maternity care, clinical decision-making, and then we are going to use the midwifery process. Here, we are not just going to do management, raw management. And that is where when I get here, I have problem with students. When we get here, we are not going to do raw management that you were doing and reassure clients. No, we are going to apply what we started as the basic, the clinical decision-making. We are going to apply the respectful maternity care. We are going to apply the midwifery process here. I beg you, take note. That is what we are going to do when we get here. So it means if we don't get the concept in the beginning, when we get here, that is where students will do their work and then I will say, go and do it again and there will be an issue. So please take notes. You are going to use it and then we are going to use it well. Then we will look at the condition of the breast, abnormal condition of the breast, and how do we manage them. And the most important thing is the traumatic complication. The traumatic complication that we have been having, the traumatic complications that we have been identifying in our facilities. Who they cause them? This is the number one question. Who they cause them? And how do we prevent it? And after causing it, how do we manage it? Where is the fault coming from? So we will do a lot of discussions. And then we look at the PPH. But here we are more concentrated on the secondary PPH. Though we will talk about the primary PPH, but we'll talk about the 24 hours bleeding. And who the cause them? We will look at it. and then we look at the way forward. Then we will talk about the DIC. Nobody wants DIC. I always say that DIC, if you have ever witnessed DIC, you will weep. So we will talk about the DIC. And we all know the DIC comes with a lot of complications. DIC comes with a lot of complications. And it is all may be coming from the almighty hemorrhage. That is the bleeding. So we will talk about the DIC. And then how do we, as midwife, prevent the DIC? Midwife save life. How do we go about it? How many of us are even able to detect DIC and manage it on time? It's an issue. So when we are done with the abnormal, then let's look at the teaching methods. We are going to do a lot of discussions. Though I'm going to start with some of presentation, group practicals, demonstrations. Demonstrations will be recorded and sent to the Telegram page. So just after here, I'm going to create a Telegram page for you. Then we look at the approaches that we are going to use, which will be student-centered approach, teacher-centered approach, and so on. It means I'm going to do a lot of talking. And then you have a responsibility to also do a lot of research. Read more. You are expected to read more so that you'll be able to understand what we are doing. If you have any question, you can type for me in the chat box, please, as we move on. If you have any question, please type for me in the chat box. Okay. This will be our reference book. If we have any of them, there are more reference book. Now, you will be reading more, you'll be doing a lot of research for me. You'll be doing a lot of research. So let's look at the assessments. So assessment will be assignments, presentation, and then we are going to do mid-semester exams. And then we are going to do end of semester exams. That will be our assessment. Okay, please, I'm still waiting. If you have any question, you can type for me in the chat box. It looks like we have more time. So let's type for me. If not, I will start. I wanted to start next week, but maybe I will start today. So if you have any question, you can put up your hands before we will start. Okay. Okay, somebody says, sister, please, can you project that assessment again? Somebody said, can you go to the reference site? Don't worry, I will send you the slide. When we create the Purperium page, I will send you the slide. Everything will be there. Okay. All right. So please, somebody is writing on my screen. The person should stop. Somebody is. The person should stop. Okay. So we are starting the class because I have by now. I will be done with the introduction. So let's start the class. Now, what is respectful maternity care? Midwives. Please, so I think I should also add this. Please, with your index number, because time students, I don't know whether I should put on my camera so that you can see the book and you know that it's true I have the book. Okay, so let me see. Anytime you answer a question, I'll give you free marks. Okay, so my video is on. Okay, so this is the book. Okay, so anytime you answer a question, I'll write your name here. So save your index number with your name. Let's do that. And save your name as it is on the score sheet. Go to the participants list, add your index number to your name. It's very, very important. Add your index number to your name. Anytime you contribute in class, you will get a mark. Even if it's 0.5. If you're able to get 0.5 10 times, you are gone. So please save your name with your index number. We are starting the class. And we are starting with respectful maternity care. Now, the question I'm asking about the respectful maternity care is, if we look at the logo, okay, so I'm going to, you can put up your hands and then I will mute you because I don't want us to make noise. So what do you see here? What do you see? And what do you think is the meaning of the images you are seeing? You can see something here. I'm pointing the cursor. And then we can see this one. So what are you seeing inside the logo of the respectful maternity care? And what do you think is the meaning? Okay, so I have the first person, Angie.
Okay, sister, what I see is a hand is open, two hands are opened, receiving let me say pregnant woman or like a child. So what to my impression is a midwife taking care of a woman right from preconception. So maybe after delivery, that is during puerperium, and with a child in a company. So I think pregnant women are in safe hands with the midwife, both the baby and the pregnant woman and the prepper mothers. They are all in the safe hands of midwives. My opinion.
Thank you. Please add your index number. It's very important. Abubakari, your index number is not added to your name. So you answer the question and then you can add it later. Yes. Oh, she's not talking, no. Oh, Abubakari. Abu.
Yeah, hello.
Yes. Your index
Hello.
number is not
Good
added
evening,
to
sir.
your name. Please do
Oh,
that after you have answered the question. It's very important.
okay, sister.
Okay, let's go.
Sister, I think respectful maternity care is human rights that is supposed to be enjoyed by every childbearing woman at any
a health facility or center he or she finds, she finds herself.
Oh, no, I'm talking about what do you see? I'm not asking you what is respectful maternity care. But what I'm asking is that what do you
Okay.
see inside the logo? Are you receiving it at your end, the slide?
Yes, please.
So inside the circle, what do you see? And what do you think is the meaning?
I see a woman, and then I think the logo means a woman and a baby that are receiving care. Hello, sister.
Please, I'm listening.
Hello.
Please, I'm with you. Oh. Okay, I think the lie is off. Okay. Ernestina. 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 Yes, Antoine.
Yes, sister.
Okay.
Please, what I see here are two hands holding up a mother and a child. And from what we can see, we've done the mother and the child in there. The symbol looks like love. So this is like midwives holding both mother and child in your arms or in your hands with love. That's how I understand it.
Thank you. Okay, so the next person is Adams. Mariama.
Yes, please, in the globe, I'm seeing two hands holding something that is to prevent it from fall. So anytime something like this is being held with the hands, meaning that thing is being held with care so that it doesn't fall off. And with puerperium, it implies to me that the midwife is trying to save the woman and help the woman so that she, at the end of the day, she'll be fine together with a baby. That is my mind. Thank you.
Okay, thank you. What name is this? Ade. Ade.
Yes, sister.
Please, your full name.
Varash.
Veracious.
Yes, sister.
Veracious.
Maupo.
Maufo. Okay, mention it for me.
Maufemo.
Mau.
Maufemo.
Famo.
Yes,
Mau
sister.
Famo. Okay, I'm
Sister, please, I
listening.
have two hands open with a mother and baby. And this implies to me that a midwife is to safeguard a pregnant woman or a woman from preconception through to puerperium. We should take care of them with love. That is how I understand the symbol.
Thank you. Okay, Judith. Judith.
Yes, sister. Sister, please. What I see is two hands opened and two images that I think is a mother and a baby with the hand holding them in a caring way, like showing love to them. Thank you.
Okay, thank you. Patricia. Patricia. Oh, Patricia. Okay, let me go to the
Hello,
last person.
hello, sister.
Yes, yes.
Hello,
We are with you.
sister. Please, can you hear me?
We can hear you.
Okay. Okay, I can see from the picture something that is looking like a baby and a mother with two hands that are supporting both of them, which means that the mother and the baby, they need to be protected, taken care of, so that nothing will happen to them. That's what I see in that picture.
Okay. That is good. Thank you. Now, let me quickly change the questions. And please, those who are online, don't leave. Now, the next question I'm asking is why respectful maternity care? Why? Please listen to the question carefully. Why respectful maternity care? Why? The question is why? Why? Okay. Why respectful? Okay, so let me call. I have a next person here. Why? The question is why? Georgina. Georgina. Please,
Hello,
your full
sister.
name. Your full name.
Please, Georgina Amengo. Amengo, Georgina.
Okay.
Yeah, please.
Georgina. Oh,
The
Georgina.
reason why it should be respectful maternity care is it's more or less like it is a human right, fundamental human right. Hello, sister, please, can you hear me?
Please, if you don't listen to the question carefully, you will deviate. My question is why respectful maternity care? Why? Why respectful maternity care?
I'm saying that it's supposed to be respectful maternity care because it is a fundamental human right that is supposed to be enjoyed by every pregnant woman. And based on the stress and the situations that pregnant women go through in the process of pregnancy, labor, and delivery, I think it is just nice to provide them with that supportive care during that stressful period. Thank you.
Thank you. Please mute yourself for me. Cecilia.
Yes, please, madam.
Please, your full name.
Awinsumia.
Awisonia. Okay. Let's go.
Madam, please. Madam, please, the question again.
Why respectful maternity? The question is why?
Why respectful maternity care? Like one of our sisters was saying, like it is a right for each individual to receive quality care or respectful care from their caregivers. So, to my opinion, I think every woman and baby needs respectful quality care from their caregiver or midwives.
Why respectful maternity care? Okay, thank you. Rebecca. Why respectful maternity care? Rebecca.
I think it's a like respectful maternity care is the key elements of the woman to
I'm not
feel
asking you
safe,
the importance
supported,
or
and
what the question I'm not asking what is respectful maternity care. I'm not asking what is respectful maternity care. I'm asking why do you think there is a need for the respectful maternity care? Why? Why the introduction of respectful maternity care? Everywhere now you go, when you go for workshop, everybody is talking about midwives, respectful maternity care. So why? That's the question I'm asking. I'm asking a simple question. If we're not careful, you end up. Okay.
I think respectful maternity to help the woman to participate in.
So you are talking about you are talking about importance, please. You see, those
okay.
my old students know how I set my questions. I'm asking you a simple question. I'm not asking you the moment you try to explain what is respectful maternity care, the benefit of respect. You have not answered the question. The question is why? Why respectful maternity care midwives? Okay, thank you. Abigail. So far, so good. Nobody has been able to answer the question. Let me try Abby. Abigail.
Yes, sister.
Yes.
I think the reason why for midwives to offer or provide respectful maternity care is
I'm not asking you midwives to provide them. I'm asking you why respectful maternity care.
Why is to identify and provide comprehensive care.
No, I'm not asking you to define what is respect. I'm not asking you what. I'm asking you why. Why midwives? Why?
Then, sister, I'm lost.
You are not lost. Why? Okay, thank you. You think about it. Let me call the next person. I'm also reading all those who are typing in the chat box, but I'm still not convinced. Okay, so let me call Cecilia. Your hands is still up. You want to please? Is this index number 696? When you come, you mention your name for me. Sorry. Is it Yahaya? Hello. Index number 696.
Yes,
your name, please. Your name. Yahaya.
Yes, please.
Yahaya what?
Zulaiha.
Okay. All right. Why?
Respectful maternity care because children and pregnant women are the vulnerable group and they need holistic care to promote both maternal and child health and also to prevent infant and maternal morbidity and mortality. Thank you.
Okay, so for you, I will give you 2/10.
Hey!
Right.
Okay, thank you.
Okay, so let's proceed. Why? There is another person, Christy. Christy, I think I'll pick just 5 people and then Christy. Christy. Okay. Christiana. Selena. Selena.
Hello, yes, madam. Yes, madam.
Okay.
At least I think so. I think it's to let the woman have a more positive childbirth experience because.
Oh, what is happening to Sissy? Selena, we can't hear you again. What is happening? Okay, thank you. We can't hear you, but we will take it like that. Christiana. Okay, Adams. Adams again. Okay, Adams.
Sister, please to provide a
hello.
Adams, we are with you. Selena, thank you, Selena. Adams, please, we are listening.
Hello, sister.
Please, I said to provide a dignified and a satisfying care to both the client and the healthcare provider. Thank you.
Okay, thank you. The last person, Mohammed. Selena, you want to come again? Mohammed.
Hello.
Mohammed.
Yes. Yes, please. Hello.
We can hear you.
Yeah. Please, respectful maternity care is crucial. That's why we practice it to enable the woman to have the best experience and also to promote maternal and newborn health outcome, positive maternal and
You are
newborn
telling me
health.
you are telling me about the importance of the respectful maternity care, but I'm also asking why.
Because it's crucial.
Thank you. All right, so thank you very much. I'm reading from the chat box. Thank you all. Okay, so we have done a little bit discussion, and then I think we have enjoyed the discussion. We started with explaining the meaning of the logo inside. People are saying they can see hands. Please kindly mute yourself, Adams. People are saying that they can see the hands of a midwife, and people are saying that they can see a pregnant woman and a baby at the same time. But I'm surprised, so nobody talk about seeing the heart. Anyway, nobody's talk about they can see something like a heart. Somebody will say midwifery is a calling. If you don't have the heart for the job, that is what people have been saying. If you don't have the heart for the job, you can't do midwifery, isn't it? I hope you all agree with me that nobody said that you cannot just come and say, because I want a job, there is no job in Ghana. The only job now is to go to nursing training. When you are done, you'll be posted. And when you are being posted, you start working and you want to earn something. So the heart that you use to do the work is not there, but you want to fill your pockets. Okay, so you talked about so many things. You have talked about seeing the hands. You have talked about seeing a pregnant woman. At the same time, you are seeing a pepper mother with a baby. At the same time, you are seeing something like a heart. You are all right. You are all right. And midwifery is about you having the love for the work. If you don't have the love for the work, you always go to work, and I don't know how to put it in English. Now, that is what they will say in Tree. Those who don't understand Tree, sorry for that. Okay, you go to work and the heart that you have to do the work is not there. So I always tell people that to be a midwife, you should have that heart. The heart of a mother. The heart to care for pregnant women. The heart should be there. That feeling, that love, the passion should be there. And that is where you don't have the heart to care. And that is why we have so many things going on now in our walls. That is why we have, so please, we are done with the discussion. Those who are still standing their work is over. I'm not reading from the chat box again. So thank you very much. So if we don't have the heart to do the work, that is where the problem is coming from. And I ask the question, why respectful maternity care during pregnancy, labor, and postpartum. Why? And the answer is simple. The answer is simple. The answer is here. Because the research was carried out at our maternity wing, and studies have shown that many women worldwide experience disrespect, abusive treatment during labor and childbirth in our hospitals, in our maternity, in our health centers. And that is why there was a need for this theory or chapter to come to stay with us. So the respectful maternity care did not just come like that. It was a research that was conducted in our wards. Then they find out that the way some midwives treat pregnant women, the way they are verbal abuse, physical abuse, all types of abuse given to women when they are pregnant, and they are coming to receive services. That is why this came to stay. And the respectful maternity care and wherever you go, everybody is talking about it. Everybody is talking about it. Why didn't we have something like respectful nursing care for the general wing? Though they are also doing their own things. However, mother passed through will leave a scar that the mother will never forget. And I know a client who passed through this trauma during labor. Then he came for the postnatal clinic visit. She saw this midwife who delivered her, and she started panicking. And when we checked the vital signs, it was very high. We asked, I said, Madam, anytime I see this woman, the way what he did to me during labor, and that's why, that's the question I asked. Why? The respectful maternity care. And that is why the logo, you see those hats, you see the hands at the same time, you see something like a hat, you see something like a mother, pregnant woman, you see a baby, the hat for the job. And somebody will say midwifery is a calling. But I beg you, if yours is a missed call, try and fit into the calling. You know you don't like to smell feces, but by all means, midwifery job that you have gone to do, you see feces coming out. The mother doesn't have any control over it. And that is the job that we have find ourselves. One of the difficult jobs is midwifery. And one of the things that the love, a job that you will be blessed and you have a love, fulfillment, job satisfaction, is midwifery. It's midwifery. However, the rate at which mothers go through a lot of pains when they are in labor, the trauma they go through, the problems they face in our hands as midwives, the abusive statements, the disrespectful manner, then there was a need for this to come to stay with us. And so that is the answer to the question, why? Why? So I'm asking you a question. Have you ever abused a client? Not only physical abuse, verbal abuse, emotional abuse. The emotional abuse is the most dangerous one. Disrespectful way, have you ever? Then if your answer is yes, then you are the cause of the introduction of this chapter or this theory to come and stay with us, the respectful maternity care. And this respectful maternity care is not only related to pregnancy, labor, and postpartum, but also to the classroom. Disrespectful manner of students, abusive treatment of students, verbal abuse and trauma. If you don't do this, I won't pass you, forcing students to do so many things before they receive a marks. They are all here. They are all here. So the respectful maternity care also goes for the press sectors. I also always say that it cuts across press sectors in the world. When students come, the way you abuse students, both verbal, physical, emotional abuse, munim tray, between these students. I like students from Mampong. I like students from Garden City. I heard students from these institutions. They are all there. They are all part of the respectful maternity care. Because the student that you are disrespecting, she also come back from preschool and said, aha, when I was a student, this person was from Mampong. He wouldn't like Mampong students. So me too, I hate Mampong students. I'm not teaching them anything. And that is what we are saying. So if you look at the respectful maternity care, it's for we, those who are tutors. It is for those in the world. And it is for everybody. Disrespectful manner, abusive treatment, even in your homes. Sometimes you go carry home to work, work to home. What happened in your house, you carry them to work. Patient or client will suffer that day. The argument you pick in the house, you go to work and you are displacing. It's everywhere. And so therefore, we should be careful. Things have changed. People have become, people have the information now, enlightened on what is right and what is wrong. People can stand out for their rights. So we said it's an important for us as midwife to know about this respectful maternity care so that we don't fall a victim. The things that we used to do, we can't do them again. Even if it's want to come, you tell yourself, hey, I should be careful. And if we look at the respectful maternity care chapter, it's a universal right for mother and baby receiving maternity care within your facility. And we said the care should be woman-friendly care during pregnancy, labor, and postpartum. Woman-friendly care. It shouldn't be like you and your enemy. So sometimes when you get to the ward, a midwife is seriously fighting with clients or patients, then you'll be looking at the midwife. The midwife, I don't think the midwife is normal. Because we have done the physiological changes during pregnancy. And you know, clients or pregnant women, they will have a mood swing. And the mood swing has come and you are fighting with them. You are supposed to understand the theory. You are rather fighting with them. And even telling your colleagues, have you seen the woman here? Don't attend to her. He doesn't respect. And I always say that what gives you the right as a midwife to be abusing pregnant women in your facility? Just because you have midwifery certificate. That certificate will be taken from you and you will find out that you don't have any power. You don't have any power. The mother and the baby need to be respected. You cannot be doing anything in your facility anyhow and thinking that you are the boss. So you have the power to do anything, to give any instructions. Whatever you do today, you pay tomorrow. Therefore, they have the right to freedom from harm and ill treatment we have been giving them. They have the right to freedom from harm and ill treatment we have been giving them. You see, the woman in your care, harm. You go to the labor ward and the woman is lying on the rubber. Na rubber net home. No, why? The woman is not even comfortable. You'll be beating the woman, push, harm. Some of them will be using the artery forces on the woman. Ill treatment, abusive statements. Oh, verbal assaults, emotional trauma. Saying all negative things to the woman to discourage the woman instead of saying positive things to encourage her to push or to move forward. You are busy saying negative things, abusive statements. Woman asks you something, you are just furious. Then if you go and look at the labor, look at the water closets filled with blood. Are you protecting the client from harm? The floor, needle all over on the floor. If the client step on it, and this needle, we don't know where it is coming from, whether from a retroviral or hepatitis B or syphilis, you are exposing the client to danger. A client with preeclampsia, nurse on the low bed or bed with side brace, you are nursing on the top bed, high bed. Are you protecting your client from harm? The client will call you, madam, please, the infusion is finished. Then you will be sitting there. Have you seen the green? Bring it down, down, down. And you go and you see that blood all over the giving set. Are you protecting your client from harm? You go and the place is swollen. You know the place has tissue, but you're still pushing that medicine inside that hole. You know the place has tissue. This place has tissue. You can't go. You are forcing yourself because you don't want to go and then set another line. So you are pushing the client to say, madam, wish. Kafra, bibi kitwa way. Then you are just pushing, pushing cloth into the heart. Are you protecting your client from harm? Now, patients don't have the right to complain. You're doing so many things in the world. And we think we are fine with it. Oh, wait, there's some moja kakra bi na aba. Wait, the moja kakra bi, this is so small blood. So that you said that instead of you to pluck and then connect, then the blood will become, or say, madam, hey, madam, my blood, hey, keep quiet. This small blood you are crying. Hey, sister. Hey, sister. Are you protecting your client from harm? Are you protecting your client from harm? The client will tell you, madam, this bed is not comfortable. When I lie down, this place there is no bed. Sleep on it like that. If you like, go to the next facility. Are you protecting your client from harm? exposing that washroom is full of blood. You ask the client, you should go and sit on it and tell Madam, are you protecting your clients from harm? You end up, patients or clients end up picking infection from the ward. Picking infection from the ward. When you go, a client who is in labor, and the way we are picking, cleaning, entering with unsterile things, and we think the client is fine, you will end up sending infection. Are you protecting your client? So anytime your client is coming back with an infection to the ward, then it means you have failed. Though clients have their own portion to do in the house, then it means your education too has failed. Are you protecting your client from harm? Sometimes you find out that this patient or client is rooming and she doesn't need episiotomy. But because you have done your calculations, today I have to get money from episiotomy because the hospital doesn't have xylocaine. I have. Mommy, I have to cut so that your baby will come out. But if we don't have xylocaine, you need to buy. Or I will cut it like that too. The woman will say, oh, madam, please, how much? Are you protecting your client? And some people even give episiotomy without xylocaine. With contraction. Pa! Madam, the client will say, which madam, what me? Be quiet. I'm helping you. Hey, sister, are you helping the client or you are helping yourself? Are you protecting your client from harm? I will end here for today. To be continued next week. Any question, you can put up your hands. Any question, you can put up your hands. I have 1 minute more to go to be continued next week. Okay, so let me quickly pick questions. Any question for the day? It's time. We will end here. Midwife save lives. So we meet again next week. Bye-bye to every